Welcome to Field Notes, Insights from N2PH Health Alumni. N2PH Health is a year-long workforce training program for those who are new into the field of public health. I'm Juliana Mansky.
And I'm Mackenzie Legal. We are program facilitators and hosts of this podcast. With a vibrant community of over 400 current and past residents, N2PH Health is a wealth of knowledge and experience in the public health field.
In each episode, we'll share inspiring stories and valuable insights from those who've journeyed into public health, highlighting their unique path and the impact they're making. Joining us today is Andrea Orest, Public Health Educator with Cook County Public Health and Human Services in Minnesota. Her focus is on substance misuse and suicide prevention, as well as local mental health resources and infrastructure. She also works in emergency preparedness, healthy homes, and disease prevention. Andrea graduated from N2PH Health in December 2023. Andrea, thank you so much for being with us today. I know a lot of your work focuses on harm reduction, and you shared this as your N2PH Health final project. Can you elaborate on this work and what you're currently doing in your community?
Thanks, I can. Happy to be here. Cook County Public Health received a grant in 2022 under HRSA called the Rural Community Opioids Response Program Grant, and it was a multi-year initiative aimed at reducing the morbidity and mortality of substance-related disorders and overdose in rural communities. It was a collaborative endeavor. The cohort itself was very large, but our main partners were the University of Minnesota School of Pharmacology, Grand Portage Human Services, Sawtooth Mountain Clinic, Grand Portage Health Services, our local schools, and then a number of other local entities and regional entities. One of the initiatives under that grant was to build out harm reduction education infrastructure and provide supplies. So since I was working on that, and then I needed to do this final project, it just seemed like a natural connection. So through my N2PH Health coursework, I developed an action plan to address harm reduction in the education, infrastructure, and supplies areas to reduce overdose events. And in the beginning of the process, we really needed to bring the idea of harm reduction into the community so people understood what it was and how important it really is to help reduce overdose. We collaborated with Cook County Higher Ed, which is another consortium member under the grant, and they are providing free naloxone and Narcan trainings to the community in conjunction with their CPR and first aid classes, as well as individual organizations that they do direct trainings for. Who attend those have access to Narcan or naloxone, whichever their preference is. We also worked to set up a free and confidential access point to supplies. Initially, we had it set up in our Public Health and Human Services lobby. Some of the feedback we received was that people were reluctant to take it because it was very public and there were cameras in the lobby. So we worked with courthouse administration to move those supplies into the restrooms at the courthouse. So there's 2 restrooms on the first floor, 2 on the second floor. And so each of those restrooms has a cabinet of supplies that we stock weekly. And those cabinets contain condoms, female condoms, dental dams, fentanyl test strips, pregnancy tests when they're available, and then emergency contraceptives and Narcan as well as naloxone. So it just created a more private area for people to access those. Another initiative that we started with our substance use disorder co-occurring case manager was a Leave Behind Kit initiative, And what that does is it allows emergency responders to leave overdose prevention kits with individuals or their family or friends if they feel there might be a risk of overdose. And those kits contain 2 doses of naloxone, the sterile syringes, a CPR mask, 2 fentanyl chest strips, and then a resource card for people if they're looking for supports on recovery or treatment or any other sort of supports that might come along with substance misuse.
Wow, you are doing a lot. That's really incredible work. Thank you for that level of service. I especially appreciate how you have leveraged some of those new to public health activities with your project into those making harm reduction tangible and accessible to the community, and really pausing to reflect and evaluate how your initial location of supplies was maybe not meeting the needs. And so moving those into the restrooms was a really important step to make those kits accessible because of the privacy on that. So love that approach. Also, it sounds like you're collaborating with a wide variety of partners, and that really highlights the importance of a united approach to tackling and being able to move these harm reduction efforts forward. So what are your next steps for some of these efforts?
Yeah, so what I'm looking to do next is to reduce more of those barriers that you referenced. So because the courthouse is only open from 8 to 4, those are the only times that those supplies are available. And then you have to come into a government building to access them. So our next step is I'm collaborating with our local community center in Grand Marais to put harm reduction cabinets in the restrooms there. So it's more, it will be more accessible to community members. It does not break the barrier of timing though, because the building itself is still only open until 4. So secondary to that, I'll also be looking into community locations that have temperature controlled entryways or something that we can put some of those supplies in so people have access after 4 p.m. Also with that sort of confidentiality being important. Such as, maybe laundromats or city public restrooms or the library, just sort of depending on what places are open and warm enough to store supplies that might freeze, right? And then our grand goal is to have a harm reduction or public health vending machine located somewhere in the county. We do work with Grand Portage Human Services on these initiatives, and they have funding to put up 2 harm reduction vending machines. So that is really fantastic. So I'm kind of hoping that we can use that momentum to bring at least one to another location in the county to, really make it more accessible for people.
Yeah, that is a great goal to continue working to and to keep that momentum going with the success of the first 2 and adding in that 3rd location, like you said. So, Andrea, thank you so much for the work that you're doing, for being here on this call today to share about this really important work. It is very clear that your efforts are driven by a deep commitment to meeting people where they are and addressing barriers to access in a meaningful and really forward-thinking way. Your work is not only saving lives, but also fostering that culture of compassion and support in your community. So again, just want to say thank you for all that you're doing for Cook County.
Thank you.
Thank you for listening to Field Notes, Insights from New to Public Health Alumni. For more information, visit new2publichealth.wisc.edu.